Hello, I am Dr. Mihir Kulkarni, consultant nephrologist practicing in Thane since the last 13 years. Today we are going to discuss on a very important topic from the kidney point of view, that is dialysis. So, when do we start dialysis? So, dialysis, it's very important to remember that dialysis is to be started before kidney disease has advanced to a point where life-threatening complications can occur. So, what are the indications for dialysis? Someone who has come with fluid overload, the kidney is not able to remove excess water, and in spite of all medicines, he is not responding. That is the time. Someone whose potassium level is really high and all medicines are unable to control, because potassium is not at all good for the heart. A high potassium can stop the heart, it can cause a cardiac arrest. So, if potassium is not controlled with medicines, dialysis has to be started. Unwanted acids are removed by the kidney. If the kidney does not remove these unwanted acids and medicines don't help, that is the time dialysis is to be started. Unexplained increase in the BUN and creatinine with alteration of the consciousness. Sometimes patients come with convulsions, coma, we have a very high blood urea nitrogen, creatinine, and that is the time dialysis helps these patients. So dialysis is done in three ways. One is hemodialysis, one is a slow dialysis, and one is peritoneal dialysis. So let us discuss about hemodialysis. For hemodialysis we need an access, and the access is a vascular access. The fistula is the choice of vascular access for a dialysis because there is less risk of infection. And the third mode of access is an AV graft. It's a synthetic tube connected between the artery and the vein, where the artery and the vein, a surgical connection of an AV fistula cannot be done. That is the time where graft is used. So ideally the first treatment of choice is an AV fistula, the second would be a graft, and the third would be a catheter in the neck. The catheter could be a temporary, or nowadays we put in permanent catheters in the neck also. The hemodialysis machine. Hemodialysis machine is the central machine where we dialyze the patients. So hemodialysis machine, blood comes out through the vascular access, it enters the artificial kidney, which we also call as a dialyzer. The dialyzer removes unwanted substances and filters out them, and the pure substances enter into the body. That is, creatinine and urea are removed from the dialyzer, potassium is removed from the dialyzer, whereas bicarbonate goes on the dialyze it into the blood and goes back into the patient. So this is dialysis, it is filtration of the blood by a dialyzer called as an artificial kidney. So as we know, dialysis, there are advantages, there are disadvantages. Let us look at disadvantages. It is safe because it is done in a hemodialysis unit. It is less stressful because there is a technician and a sister and a doctor around who look after a dialysis procedure. It is comfortable for the patients. It is faster and more efficient compared to other dialysis called as peritoneal dialysis. It takes less time, 4 hours a week is required for one session. Ideally we require 2 or 3 sessions a week. Ideally it's a platform to meet and interact with other patients with similar problems, so sometimes it does help in decreasing stress because kidney patients are stressed out a lot. There is lesser risk of infection and it is less costly compared to the other modes of dialysis. But there are disadvantages. Travel can be an issue. If the patient's dialysis center is far away from his house, then travel could be an issue for the patient. There's a fixed schedule. A schedule is given to the patient 4 hours a week. So he has a Monday, Wednesday, Friday, or a Tuesday, Thursday, Saturday. He has to ideally stick to that particular time and go for his dialysis. So that can slightly interfere sometimes with his work. There is a needle insertion involved in the fistula. So it could be painful, but nowadays there are creams and sprays of lignocaine jelly which are put around the fistula entry site around 30 minutes prior to insertion of the needle, so even the pain is minimized. There is less dietary freedom. In spite of we are doing it just thrice a week, so sometimes potassium and all may be on the higher side. So there are fluid and dietary restrictions sometimes on hemodialysis. So these are some of the disadvantages of hemodialysis. The other mode of dialysis is peritoneal dialysis. And the last thing I would like to emphasize is a kidney transplant. That is the ideal treatment or the treatment of choice for an end-stage renal disease. It is the gift of life. There are a lot of transplants like a living donor transplant or a deceased donor transplant, but kidney transplant is still the best amongst all treatments for end-stage renal disease. So why should anyone go on dialysis? Let us protect our kidney. That's very active. That's very important. If all these things are followed, these are the 8 golden rules for healthy kidneys. Let us just follow this to avoid dialysis and transplant anytime in future. Thank you.